Hi everyone, this is Dr. Matt, and you're listening to Take Back Your Health, where we talk about all things health and ways to help you be the best version of you. What's up everybody, this is Dr. Matt with New Directions Chiropractic, and this is Take Back Your Health podcast, and I'm here today with two very special people, Kelly Lukomsky and Kylie Mazzoli. Get that name right, they both sound Italian to me. Kelly, nice to have you here.
Thank you.
And Kelly and Kylie. I'm going to say that a lot.
It's easy to get confused.
Yeah, I know. So first of all, let's do some introductions. So Kelly, tell us a little bit about you.
Sure. I'm Kelly Lukomsky. I'm a licensed massage therapist. I have been licensed and I own Carolina Synergy Massage and Bodywork LLC here in Hickory. I've been practicing massage for 3 years, specialize in deep tissue and gua sha, which is fascia scraping. I attended Maiden School of Massage, and I'm a mom of 2 teenage boys, and they keep me busy other than my business.
That's the hardest job, right?
It is.
So Kylie, what about you?
My name is Kylie Mazzoli. I am a licensed massage therapist as well as a licensed esthetician. I also attended Maiden School of Massage around the same time as Kelly, but I've only been licensed for 2 years. As far as specialties go, I think I just specialize in listening to what each person's body needs. My massage techniques vary depending on what I feel like your body is telling me it wants. I'm a dog mom.
Hannibal Lecter is her dog, yes.
He's a rescue, so he's special. But other than that, I am really into drag racing. I do a lot of traveling for that. And I'm currently planning a wedding, which is probably more stressful than I thought it would be.
Yes, I can imagine. So you both said you went to Maiden Massage School, which I'm sure a lot of people have heard of that about the same time. So what's the requirements for massage school? Like, what do you need to? I know what I need to be a chiropractor. What do you need to be a massage therapist? How many years of school? How much education, hours, etc.?
It's normally most courses around here, most schools require, if you go full-time, 7 months. Is full-time. That's usually 4 to 5 days a week, average of like 8 hours a day.
Oh, so full-time job.
So
basically.
full-time job, yeah. Fortunately, I was able to do that type of schedule for schooling. And then it's a requirement of, most schools are 500 to 700 hours of actually taught training, and then you have 150 clinical hours where you're actually doing hands-on massage in the school, and that can consist of 1 or 2 days a week, afternoons, and once you complete that, then you go through a state exam process, much like nursing, cosmetology, things of that nature. Once you pass your exam, then you send in for your licensure, and the state of North Carolina Board of Massage license you to practice in the state.
What she's leaving out of that is the very strenuous application process you have to go through to receive that licensure, because that involves fingerprints, background checks, 10 years of work history and living history. It is a whole exam in itself.
So when I'm getting it, it's not just a weekend course that you can take to massage somebody, right?
It is definitely not. It's a lot of commitment.
I actually attended night classes, so mine was going 2 to 3 nights a week for 14 months, but only going 4 to 5 hour classes.
Gotcha. And it's probably a financial requirement, a financial burden as well, I'm sure, or would it not be? How much?
Not as bad as typical like university or college studies. I think mine ended up being maybe a little over 11, including exams and everything by the time I was fully licensed.
That's not too bad. Okay. Yeah. I know for chiropractic school, that's $250,000 right there. So I wasn't sure of the financial requirements for that, but
I feel like it was, I think it was around 10,000 for schooling.
Right.
And then you have a couple of hundred in exams and licensure fees afterwards. Insurance.
Gotcha. So I know everybody has their own definition of what a massage is. But what's your definition of a massage? What the purpose of it is, I should say.
Mine would be, massage can aid in so many health conditions and concerns that you might have. A couple of the main things that we hear people have success with improving is high blood pressure, anxiety is a big one now, depression, loss of sleep. So things like that you might be struggling with to function on a daily basis, massage can help. Anything that would be coupled with like chiropractic work.
Mm-hmm. Oh, yeah.
So anything that you've got your physician trying to better your life with medication, a lot of times those can be improved with massage.
Gotcha.
I'll let Kylie share a few.
Massage is just such a great tool to help alleviate pain
Yeah.
and stress reduction. I've always been a huge believer in the gift of touch or the healing touch. It's always been something that's made me extremely passionate, and just how we as humans need human interaction to really
Exactly.
thrive in life.
Exactly.
And I've always thought it was very meaningful that sometimes, especially with elderly clients, you may be the only person that has given them any human interaction in
True.
that week or even that month, depending on their situations.
Well, some people probably think massage is just rubbing on somebody, and that's not the purpose of it. I mean, obviously, there's different techniques, and it kind of brings us to our next question. Because you mentioned the different techniques that you both offer, probably specialize in different ones. You mentioned deep tissue, the gua sha, and all that, and Swedish and all that. So, what is the most popular technique, I should say, and then what's your favorite technique to do?
When I look at my clientele, the most popular or the most needed in my practice is deep tissue or,
Yeah.
myofascial release.
The get down nitty gritty, right?
Yeah, because my clients are coming to me with whatever the issue is, whether it's tension in their neck and shoulders, lower back, legs. And that can be from just the job they do to the type of workout or training that they do. So deep tissue is definitely probably 95% of what I do in my practice.
So is that your favorite technique?
It is my favorite. It is my favorite, along with, of course, because I specialize in gua sha. That's one of my favorite, and that just allows people to be able to get additional relief in those deep muscle tissue areas where they're having concerns and tension through a less invasive method.
Gotcha.
No bruising, less soreness, and
Really? I would think gua sha would be more intense with the scraping because
it's really not. It's less soreness, no bruising at all compared to like cupping.
obviously, that's a whole different technique. What about you? What's your favorite one, Kylie?
I think my favorite would have to be what I consider therapeutic. I like to combine Swedish and deep tissue, but at a lighter pressure than deep tissue. At least that's how I foresee what I'm doing.
So you mentioned Swedish. Can you explain what Swedish? Obviously, you're not doing it in a Swedish accent or something like that. But what exactly is Swedish? It's just relaxing, correct? Is that what it is?
Technically, that's the best way to describe it to people, is that if they don't understand what Swedish stands for, then you would explain to them that's more of a relaxing massage.
Okay.
It just involves light to medium pressure, as well as long, like sweeping strokes.
Gotcha.
So it's supposed to be more relaxing, and it almost can borderline.
Not as much pressure.
Yeah.
Yeah, because I know a lot of people think that when they think massage, it's get in there and squeeze out all the tension, and that's not. I mean, there's different techniques.
Sometimes more pressure isn't always a good thing for your body. I
No.
feel like a lot of people think it is, but sometimes I feel like you can accomplish the same things with a lighter touch. It's easier on me, but it's also easier on you and for your body to recover afterwards.
How often should somebody get a massage, in your opinion?
I think that's going to depend on the client. I know I try to customize for each individual based on their needs. I would say anything that's acute, like pulled muscle spasms, tension in the shoulders and neck from working a desk job. Those kind of examples would be, let's do that acute care, which might look like once, maybe even twice a week, and that could be up to 2 or 3 weeks until we see how the body's going to respond to it. And that really comes from great communication with my client and understanding what's going on with them. And then monthly maintenance. So I tell people, once we get to the result that you're looking for, the goals that you're wanting to have through massage, then we can do once a month maintenance for most people. I have a good majority of my clients that do bi-month or bi-weekly, where they come twice a month. So that's not uncommon as well.
Gotcha. And to scoot to the next question, who shouldn't get massage? Now, obviously, I know anybody can get a massage, but there's probably contraindications, just like there are in chiropractic. But who shouldn't get massage?
I think there's normally ways around a lot of contraindications, like some skin issues, like if you have like a sore or a cut or an open wound on your leg, normally, depending on how bad that is, we would tell you maybe you should not. But there's also the option of having, like, being able to work around that. So just, okay, you have a big cut on your leg, I'm not going to massage that leg if you're okay with that. The biggest thing that we really will not or do not prefer to massage you is if you're sick. If you're running a fever, have a flu, the cold, anything like that, we prefer for you to cancel and reschedule. We'll happily get you in.
Yes, I would assume so.
So basically any contagious disease, any contagious skin condition.
Or cancer specifically, I would think. Metastasis.
Cancers, especially skin cancers. But if a person is going through active chemotherapy treatments, of course, that's not only a situation potentially for them, but also the therapist, because that can leak out of their skin.
Of course, yeah. And you can obviously work with people on that, but I know the big, some people might not understand is like you can get a massage if you're pregnant, and you can get a massage if you're a senior or something like that, or if you have tattoos.
We
or
prefer
things like
not
that.
to massage you in your first trimester.
Well, yes.
Your second and third, yes, that would definitely be acceptable, but we feel like for the safety of you and your child, it's best not to do it in the first trimester.
Yes, but you can do it. It's not a contraindication.
Yeah,
because some people feel
absolutely.
like I'm pregnant, I have to wait until I give birth before I can work on my back. And it's
Definitely
like,
not.
No.
Definitely not. We're trained and versed in being able to make our client comfortable if they're pregnant. We have plenty of pillows, plenty of positions that we can offer for them to lay in to make it relaxing and comfortable for them.
Good. That's good to know. But no, and another thing, I want to know what your favorite thing about what you do is, but I'll skip that question. We'll go to this one first. How do you handle a client that might be apprehensive to get a massage, or they're not comfortable because they've either never had one, or they don't know what to expect, or they're not really comfortable with the idea of somebody, I should say, rubbing on them, so to speak, or they've had previous trauma, like some abuse issues, things like that. How would you handle, or how do you handle clients like that?
I think just trying to, be able to have open conversation with them about what their concerns are. And sometimes they're not willing to voice that at the beginning.
Of course, yeah.
Or the first meeting that you have with them. But just trying to make sure that it's comfortable through the whole process for them is the biggest
It's building
thing.
that rapport.
It's building
Yeah.
rapport. It's making them feel safe in the space that they're in and respecting those places for them.
Because it's very vulnerable. I mean, you're laying under a sheet with not much clothes on, so you have to ask permission. You have to make sure the client's comfortable, right?
Very much so. But we are also trained to let people know they can dress down to their comfort level.
Yeah, you don't.
We will make recommendations on what we feel like you're going to get the most out of your massage with, but I at least always tell people if at any point anything makes you uncomfortable, all you have to do is let me know, and I will gladly adjust my technique, my pressure, anything you need to make this situation more comfortable for you.
Yeah, it's supposed to be catered to the patient. It's not every massage is the same. It's supposed to be an experience that they're supposed to have. So, yeah.
And they are all individual experiences with massages.
Exactly. Now, Last question here before we wrap it up. What's your favorite thing about what you do?
That I can take a client who has come in pain and discomfort and made them a believer that massage needs to be part
I love those patients. I know.
Part of their normal care. That, you can have a massage that is productive in making you feel better.
Good. Yeah.
So that's my favorite part of it.
I love those kind of patients when you make them believers, thinking, medication's not the only answer out there.
Yeah.
It's actually not really an answer, but what about you, Kylie?
I honestly have to say I'm right there with Kelly. I feel like in this profession, I think that calls to you to be able to make people feel better, like relieve their pain. Even if I'm just giving someone a relaxing massage, just like when they stand up, the relief on their face is more than enough. That makes my job worth it 10 times over. And along with medication, also massage can prove that surgery is not also always necessary.
Oh, yeah.
And that's a huge one, too. When I have people who are like, well, I have this thing going on, and my doctor said, surgery might be the only option, and you bring them in and you work on that area they're having issues with, and they're like, oh, wow, I didn't know it could feel like this again.
Yep. I know. I hear that all the time. Well, I tell people, cutters want to cut, so that's what they're going to do. When you go to a surgeon for answers, what's their option? Cut, right? Yeah, exactly.
Massage therapy is still one of those things, though, that I feel like we're starting to gain respect in the medical industry, but it's still not quite there yet. And I feel like the longer it goes on and the more advanced the techniques get, maybe it'll be viewed that way eventually.
I'm a chiropractor. I'm right there with you. We're in the same boat, rowing against the stream, upstream, trying to hey, we're professionals too. They better give y'all respect. That's a full-time labor. Y'all are exercising every day. I don't know how y'all rub on people for hours on end.
Yeah,
it's a lot of getting in there and. I don't have that energy.
It's a full day of table massage where you do 60 or 90-minute sessions. You might have, 5 or 6 or 7 clients. They compare that physically to training for a triathlon.
I was about to say, y'all are doing a lot of manual labor when you're, because I know Kylie told me she doesn't like to see, 6 or maybe 7 people a day. And you're like, I'm used to seeing way more than that. But then again, I'm only seeing them for 10 or 15 minutes. You're seeing them for an hour and a half, and you're actively rubbing on them all day. So that takes a lot out of you. I know I was working on your wrist the other day. I could tell. So what's the best way to get a hold of you if you wanted to book an appointment with yourself?
You can definitely find myself or my business, Carolina Synergy Massage and Body Works, on Facebook. You can contact me at 828-448-0204. Text me, call me, or you can actually find me on Vagaro, which is a website where you can schedule for things like massage, facials, things of that nature.
What about you, Kylie? How can they get a hold of you?
You can definitely get a hold of me through Facebook at either my name, Kylie Mazzoli, or I have a Facebook and Instagram page set up at Kylie Mazzoli Aesthetics and Massage Therapy. You can text me. I prefer text because I'm horrible at picking up the phone. But, at 828-578-2614. And I also have a Vagaro account as well, and it is under Kylie Mazzoli too.
And she also does aesthetics as well. It's not just massage. So you do what, facials and waxing and all that as well?
Mainly just relaxation facials and body waxing for small areas like facial, Brazilian, underarm.
Gotcha. Okay. Yeah, just because I know a part of her name there, she said the aesthetics, so I was making sure people knew that she does that as well.
Yeah. A lot of people don't know what that word means.
Yeah, it's a big word. Well, thank you both for coming out today and explaining the benefits of massage. Is there anything else you'd like to leave us with before we wrap it up?
I always like the quote that I use at the end of every presentation that I've done. It's, if you listen to your body when it whispers, you won't have to deal with it when it screams.
Ooh, I like that. I'm stealing that. That's a new T-shirt idea right there. I like that. I've never heard that. Awesome. Well, I appreciate it. Thanks for coming out.
Thank you for having me.
Thank you for having us.
If you'd like to learn more about something you just heard, or are interested to see how chiropractic care can help you, You can visit our website to schedule an appointment at newdirectionschiropractic-nc.com. Be sure to follow our social media accounts for more tips and information on how to be a better you. Thanks for listening.